Good morning. It's February 27th, and this is your daily brief in science. Here's everything you need to know. A cancer breakthrough in the works, or a regulatory milestone in sight? In a pre-specified interim analysis of the Phase 3 trial BL-BO1D1-307 in China, iza-bren or iza-bren, met its dual primary endpoints of progression-free survival and overall survival in patients with unresectable locally advanced or metastatic triple-negative breast cancer that progressed after taxane therapy. The top-line data come from a collaboration among Biokin, SYSTIMMUNE, and BRISTOLMYERSSQUIBB, with Biokin in China and BMS involved outside China. iza-bren has already earned FDA Breakthrough Therapy designation for EGFR-mutated NSCLC and Chinese CDE Breakthrough Therapy designations across multiple indications, with additional CDE approvals for esophageal squamous cell carcinoma and nasopharyngeal carcinoma under review. The stock traded around $60.95 at the time of the report, reflecting modest declines as investors weighed the news against broader market conditions. Near-term technicals show weakness for the stock, with prices below key moving averages and a neutral RS1, signaling mixed momentum ahead of further data. Analysts' views are mixed from hold to overweight, with price targets ranging from $60 to $75, supported by recent initiations and raises from several banks. Both SYSTIMMUNE and BRISTOLMYERSSQUIBB caution that forward-looking statements carry risks, including regulatory outcomes, collaboration results, and commercialization timelines. The press release includes standard risk disclosures about regulatory approvals and potential need for further data before any definitive conclusions. Investors are watching progression-free survival and overall survival as critical metrics, with positive top-line results potentially influencing regulatory dialogue, development timelines, and future revenue potential. Interim top-line data from the trial BL-B01D1-307, NCT 06382-142, were announced by Biokin, with full data to be presented at an upcoming medical meeting. The top-line results come from a collaboration among Biokin, SYSTIMMUNE, and BMS, with fuller data and interpretation to be shared at a future conference. Current data are interim. Comprehensive results and analyses will be provided at the next medical meeting when the full dataset is disclosed. A Rutgers-led study upends the idea that Antarctic glacier meltwater is the main supplier of bioavailable iron to the Southern Ocean, a finding with potential implications for iron fertilization theories and climate forecasts. Isotopic analyses reveal a subglacial liquid meltwater layer beneath the glacier with low dissolved oxygen, promoting dissolution of bedrock iron oxides and pointing to a significant bedrock source of iron rather than ice shelf melt. The research suggests climate models and predictions of phytoplankton blooms and carbon sequestration may need revision, as glacier-driven iron input appears less influential than previously thought. Lead author Venkatesh Chinney of Rutgers, with Rob Sherrill and collaborators from Texas A&M, Janelle Steffen, Jessica Fitzsimmons, and Tim Conway, contributing isotopic work. The study comes from a collaboration across multiple U.S. institutions and UK partners. Isotopic signatures show inflowing upper-modified circumpolar deep water carrying crustal-like iron 5-6, while the outflow dissolved iron is lighter, indicating iron reduction within sediments as a key source to the outflow plume. At Dotson Ice Shelf in the Amundsen Sea, meltwater accounts for about 10% of dissolved iron exiting the cavity. Most iron comes from inflowing deep water, 62%, and shelf sediments, 28%. The Dotson study, conducted during a 2022 expedition aboard the Nathaniel B. Palmer, combined ship-based measurements and isotopic data from Rutgers, Texas A&M, and the University of South Florida. Methods included ship-based CTD surveys, velocity profiling, dissolved and particulate iron measurements, and iron isotope analysis to identify upper MCDW as the primary driver of meltwater input and the main source of outflow dissolved iron. The broader Southern Ocean context remains critical. Iron availability is linked to phytoplankton activity and the region's role as a major biological region and carbon sink. Published in Communications Earth and Environment on February 26, 2026, the study is described as the most accurate measurement to date of iron inputs from an Antarctic glacier. Researchers call for further work to understand subglacial processes and to quantify iron fluxes across different Antarctic regions and times, noting caveats and the need for broader investigation. A large Swedish study tracked nearly 1 million women born 1985 to 2001 to test long-term protection from the quadrivalent HPV vaccine against invasive cervical cancer over 18 years. The nationwide register-based study followed 926,362 participants, of whom 365,502 received at least one HPV vaccine dose during the period, and 930 cases of invasive cervical cancer occurred, with 97 among vaccinated individuals and 833 among those unvaccinated. Researchers adjusted for socioeconomic and demographic factors and conducted sensitivity analyses, aiming to strengthen robustness despite the observational design. The study, published with a 2026 date and DOI, confirms prior findings that vaccination reduces cancer risk and shows no signs of waning protection during follow-up. Limitations include potential misclassification and unmeasured lifestyle factors such as smoking and sexual behavior. Common caveats in observational studies, though results align with immunological data on durable memory. Additional notes mention possible healthy volunteer bias and unmeasured variables, but the core finding remains a substantial risk reduction for vaccinated individuals. The collaboration involves the Public Health Agency of Sweden and Karolinska University Hospital, with funding from Swedish and European Union sources, and no reported conflicts of interest. Further support came from the Public Health Agency of Sweden, Karolinska Institutet, and other Swedish and European funders, with researchers stating no competing interests. Results indicate early vaccination of preadolescents and no need for booster doses in the general population, supporting global cervical cancer elimination goals. Across the 18-year span, protection remained strong, and the data show substantial long-term risk reductions for those vaccinated, regardless of when vaccination occurred. While data on HPV type-in cancers and individual lifestyle factors are not available, the study leverages large-scale real-world registry data with long follow-up to provide robust evidence of sustained protection. A genetic analysis suggests some mosquitoes began preferring human blood around 1.8 million years ago, possibly tracing back to Homo erectus. Researchers sequenced DNA from 38 mosquitoes across 11 Leucosphaerus species collected in Southeast Asia between 1992 and 2020, and used computer models to estimate mutation rates and evolutionary histories. The study indicates this shift to human feeding occurred well before anatomically modern humans arrived in the region, meaning mosquitoes pre-adapted to hominin hosts prior to Homo sapiens dispersion. The findings highlight the role of olfactory genes in host-seeking behavior and how changes in those gene sequences could underlie ecological transitions in vectorial behavior. Only a minority of mosquito species, about 100 of roughly 3,600, have evolved to bite humans, yet their impact on disease transmission and human history remains significant. The study places mosquito evolution in the broader context of ongoing malaria and vector-borne disease concerns, underscoring the public health relevance of host preference research. It links mosquito evolution to human evolution, offering insights into how ancient hominin migrations may have shaped vector-host dynamics and disease risk. The proposed mechanism involves the evolution of genetic encoder receptors that detect hominin body odor, suggesting gradual, geographically localized adaptation in Sunderland's Anopheles leucosphaerus mosquitoes. Sunderland is identified as the epicenter for the dawn of anthropophagy in mosquitoes, with multiple changes in body odor receptor genes driving host preference shifts. The study notes that humans are creating novel selective pressures, which could push mosquitoes to adapt further and potentially increase encounters with human blood. Co-author Catherine Walton suggests the switch to human feeding predates anatomically modern humans, implying Homo erectus or other early hominins were the drivers and needed to be abundant locally. A new oral GLP-1 pill from Eli Lilly is showing stronger weight loss and better blood sugar control than the current oral option in a Lancet trial of about 1,500 people with type 2 diabetes. In Achieve-3, a Phase 3 study across 131 centers in Argentina, China, Japan, Mexico, and the United States, orforglipron produced average weight losses of roughly 6 to 8% versus 4 to 5% with oral semaglutide over a year. At higher doses, 12 to 36 milligrams, it led to 15 to 20 pounds of weight loss over a year, with additional improvements in cholesterol, blood pressure, and triglycerides. Experts caution that longer-term data and real-world adherence and tolerability will be crucial for real-world success. Tablet-based GLP-1 therapies could be transformative due to easier use, storage, and potentially lower costs, though safety and regulatory considerations remain. Clinicians emphasize the need for a range of safe, effective treatments to reduce obesity-related risks and broaden access beyond private prescriptions. Many experts view the findings as a meaningful step forward in weight management for people with type 2 diabetes, with potential access expansion if approved, given NHS limits on weight loss injections. Despite stronger weight loss results, questions about long-term safety, cardiovascular outcomes, and sustained effectiveness persist due to tolerability concerns and the study's one-year duration. The pill offers practical advantages: no fasting, no timing constraints, and no refrigeration, facilitating distribution, though higher efficacy comes with more gastrointestinal side effects and about 10% discontinuation at the highest dose versus around 5% for Rybelsus. Experts see the trial findings as potentially shifting weight management and diabetes care, with incretin-based therapies possibly becoming prominent first-line options in the coming decade. Lilly has increased manufacturing capacity to meet anticipated demand, with analysts viewing orforglipron as a potential game-changer in weight management and diabetes treatment, poised to reshape the GLP-1 landscape in 2026. If approved in the United States, orforglipron could reach the market as soon as spring 2026, potentially priced around $300 per month, notably lower than injectable GLP-1 therapies. This has been your Daily Brief in Science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. We'll be back Monday with everything you need to know.